get this party started.
Good evening and welcome to Let's Talk Hormones with me, Carolyn Zallmeyer, bioidentical hormone expert. We're live streaming on Facebook on the Low TE page, live on 95.3 FM and 1470 AM here in South Florida, and also on the iHeartMedia app found under WNN 1470. During the next 30 minutes, if you have any questions for me or my guest, you can call in to 1-888-565-1470, or you can send us questions through Facebook. We'd love to answer your questions today on tonight's topic, improved thyroid treatment, and also on bioidentical hormone pellet therapy. So please call in or post your questions on our Low TE Facebook page. Many of my patients and fellow practitioners seem to be a bit confused about thyroid treatment. Many questions pop up, such as, what does a thyroid really do? What are the symptoms of a sluggish thyroid? What is the difference between synthetic thyroid medication and desiccated thyroid medication? And is low thyroid the cause of my weight gain? I'm Carolyn Zallmeyer, nurse practitioner, bioidentical hormone expert. I've been prescribing hormones here in South Florida for over 28 years. I currently own and operate my practice, Low TE Florida, which is located across from Holy Cross Hospital on Federal Highway in Fort Lauderdale. I'm affiliated with BioT Medical out of Texas, and I've studied under Dr. Gary Donovitz, the founder and CEO of BioT Medical. With the BioT method, we utilize pellet therapy to optimize one's hormones, leading to better energy, mood, sex drive, better sleep, and joint pain relief. I'm currently the #1 provider in Florida and #2 in the nation. BioT Medical has trained well over 3,000 providers throughout the United States, and we all go through the same rigorous training. In our training, we do learn about thyroid, and we are able to scientifically dose desiccated thyroid. We have learned that if we optimize a thyroid, we get a far better result when optimizing one's hormones. Tonight, I'm so happy to share with you my guest, Dr. Gary Pepper. Yes, Dr. Pepper. His practice is located north of us in Palm Beach, Florida, and he's joining us tonight by telephone. Welcome, Dr. Pepper.
Hi, Carolyn. How are you doing?
I'm doing well, and you?
Pretty good.
Good. So share with us a little bit of your, just a little bit about you, your education. I know you went to some great schools, so share with us how you got to where you are now.
All right. Well, I started off at PS 205 in Queens.
I was thinking more like Columbia.
Oh, yeah. That came afterwards. So, I went to college at Columbia in Manhattan, and then Tufts Medical School in Boston, and then came back to New York and trained at Montefiore Einstein up in the Bronx. And after that, I went back into Manhattan, where I trained in my endocrine fellowship at Mount Sinai. So I like to tell people I was to every borough in New York except for Staten Island, and a little bit of time up in Boston. So yeah, I've seen quite an array of different institutions and met a lot of very interesting, knowledgeable people along the way.
Mm-hmm. So you're trained as a traditional medical doctor, endocrinologist?
Correct.
Excellent. And when did you become so passionate about thyroid correction and improving our thyroid correction rather than following the traditional medical model?
Well, trying to be, brief about it, when I was at Einstein during my internship and residency, I met some people who were studying what is called neuropsychoendocrinology, which is the relationship of hormones to mood and the effect on the brain. And at that time, they were studying whether one of the thyroid hormones, which we probably talk about more in a few minutes, called T3, whether T3 would help people with depression. And what they found was that it did have some benefit for people with depression, but unfortunately at that time not as much as it was originally hoped. but it still does have some impact on the brain and how we feel, our moods. And then later I met some people at the Bronx VA hospital who were studying schizophrenia and learned more about the chemistry of the brain and how it affects how we feel, our moods, and all that. And then at Mount Sinai, the head of our department, this very brilliant woman, Dorothy Krieger, was involved in the discovery of endorphins. Do you remember hearing about endorphins?
Of course, yes.
And this was in the 80s, and they discovered chemicals in the brain that our bodies actually make that are like morphine and help in regulating mood and pain perception. So, from the very beginning, I was interested in the relationship of hormones to mood and how the brain functioned. And then in the last 20 years, I've been in private practice here in Florida. I realized that so many of my patients with thyroid disease had a variety of mood issues, and brain fog, for example, is a very common complaint in people who don't have enough thyroid hormone. And I was disappointed to find that a lot of my patients didn't respond to synthetic thyroid hormone, which is the traditional approach. I'm allowed to mention brand names, right?
I think so. Yeah, absolutely.
Yeah, like Synthroid and levothyroxine,
yes,
Levothyroid, and numerous other. They're all the same, though. They're all one of the thyroid hormones called T4, and that didn't seem to cut it. And then I, remembered all of the training that I had years before, and I realized, well, maybe there's a missing ingredient. And I had some bad experiences with some compounding pharmacies trying to add T3 to people's levothyroxine. And so I realized, why reinvent the wheel? You have this product, desiccated thyroid extract, that has all of the important thyroid hormones all in one, inexpensive and readily available at the pharmacy. So I began to use that and was very happy with a lot of the very good results. Then the next thing was, why aren't my colleagues prescribing this? And I don't know, it will probably take another hour to
yeah,
explain.
I don't know if that's easily explained.
Right. But I have, some theories about why desiccated thyroid extract, which has been around for 100 years, got put on the back shelf. And so many of our traditional physicians have no idea about it, or what ideas they have are really misconceptions. So that's where we are now.
I started prescribing. I've never really prescribed the synthetic hormones or the synthetic thyroid. I learned about desiccated thyroid at my bio-T training, and I was a little bit skeptical about correcting the thyroid, and I thought, well, I was trying everything myself. I was getting pelleted. I was starting on our nutraceutical supplements, the whole thing, and I thought, well, I'll give it a go. So I started taking my thyroid, my desiccated thyroid in the morning, following the instructions, not eating or drinking anything for a half hour after. And I didn't really notice anything major, but I also, the pellets were kicking in, so I was noticing some other things. So what happened was, about a month after I started, one Saturday morning, I was kind of dragging around, and I just really didn't feel as clear. I wasn't thinking as clear. I felt sluggish as I had, say, the week before. So I went to my bedside table to look to see if I had taken my thyroid. I usually put it out on a little dish on my nightstand. Sure enough, the thing was empty, so I must have taken it. But then I turn around and I look at my Labrador, and he was 125 pounds, and he had eaten it. He would look like, oh my gosh, I want to go swimming, I want to go running, and I'm like, I want to feel like you do. So I took my Thyroid, and then within a half hour, we were both in the pool having a good time. So I really noticed the difference when I didn't take it. It wasn't necessarily that I felt it when I did take it, but it was more clear to me when I missed it.
Yeah, hormones like thyroid hormone take some time to enter the system. It's not like a Tylenol for a headache. It may take days to build up, but once the hormones, the thyroid hormone, the word that we use is equilibrate, which means reaches a level in your blood that's therapeutic. People really do begin to notice the difference, and things that you had mentioned. One is this brain fog. A lot of people with low thyroid, don't feel that they can think as clearly or as quickly, and that's one of the hallmarks of low thyroid. Is an effect on your ability to think logically or clearly or quickly. I do think it's important to mention, to the public about what thyroid hormone really does, and in the body, it controls what we call metabolism, and our body, all of our functions, from the brain to the heart, to the intestines, to our muscles. It's all a chemical reaction. And thyroid hormone controls the rate at which our body does its chemistry. So if you have low thyroid hormone, all of your chemical reactions are slowed down. So all of these systems, again, from top to bottom, will slow down, including your thinking. But also people get constipation because the bowel slows down. They get muscle cramps because the muscles aren't breaking down the enzymes properly. Your cholesterol can go up for the same reason. So there are multiple issues, not to forget hair, skin, and nails. Mm-hmm. I don't know if you had that experience, but people with low thyroid have dry skin and hair.
Yes, I have many menopausal, perimenopausal women coming in with hair thinning, which, of course, it's natural to lose a little bit with menopause, but they don't like it. And a lot of times once we optimize the thyroid, we can take care of it. And the problem for me is there's so much misinformation out there that people will say, oh, it's my testosterone, or your hairdresser will say, oh, it's your testosterone. No, it's the thyroid. We need to optimize the thyroid to have a nice head of hair. Right.
Well, again, hair, skin, and nails come all from the same building blocks, and your body is busy making these proteins, and if the thyroid levels are too low, the whole process slows down, and the result is what we just described.
Yeah, I always think of, and I've described, our thyroid is basically located here at the bottom of our neck, and it's a gland that just secretes the hormones that help. I always call it like the conductor of the body, like it's taking care of everything, making sure everything's in tempo, and it's all working together.
Yeah, that's a good analogy. The tempo slows down. It's as if you had, like, in the old days, if you had a 45 record and you played it on 33 or something, everything seems slow and blurry. Fortunately, in the old days, before there was any thyroid treatment, people can get quite sick if they don't take thyroid hormone and their body is deficient. Nowadays, we talk more about quality of life, and if you have low thyroid and you're on synthetic thyroid hormone, you won't have necessarily serious medical issues, but your quality of life will be much lower. So we're fortunate, however, that treatment is very affordable and available, even if it's not necessarily the best.
Yes. Now, listen, what I think we should make sure I'm saying this right. When we take, like, our thyroid produces T4, and it needs to turn into T3 before we can actually use it. And so what we're giving with the desiccated thyroid is not just the T4 like the synthetic, but it's the T4 and the T3, so you're getting the bioavailable thyroid that your body can use, along with some for the storage. Is that a good way to describe it, Dr. Pepper?
That's exactly right. The hormone that is most commonly used, which is Synthroid, Levoxyl, or levothyroxine, which is the generic, is only one of 4 possible thyroid hormones. That's why it's called T4. And T3, which is the missing ingredient in some cases, which you can get with desiccated thyroid extract, is really the active form of the thyroid hormone. And what that means is that it affects the cells, whereas the T4 is really just the messenger that takes the hormone to the places where it's needed, and then at the sites, in your brain, in your heart, in your kidneys, in your muscles, it's converted into T3. And because desiccated thyroid extract already has T3, your body doesn't have to break it down.
So it makes it easier for the body to actually process it and function properly. Now, you have something called the Thyroid Project. What is that?
Okay, well, thank you for mentioning that. My biological clock is ticking. I've been in medical practice 35 years, and I've discovered something that I consider to be extremely valuable. 1 in 10 women have some form of thyroid problem. If you go to any group of people at a party or whatever gathering, there's without a doubt you're going to have several people there. There are more than 10 or so people who have thyroid disease. So it's extremely common. It's very important to the well-being of many millions of people. And, I'm on the committees, the national committees of endocrinologists, and I've talked to my colleagues, but I know it's going to take many years more before the traditional medical committees begin to recognize the value. So I've taken it on myself to create what is called the Thyroid Project, and you can find it on Facebook on the under the name of my website, which is Metabolism.com, which I've owned and operated on the internet since 2000. And anyway, on Facebook you'll find, if you search Metabolism.com, the Thyroid Project, which is a way of sharing the information that we have now about how successful this treatment is. I would like to try to share it, with the general public, but I'm hoping that physicians will also latch on to this. And what it is basically interviews in my office with people who've given me permission to show their stories. And because there's so much skepticism among different groups, including physicians, about, well, what is DTE, and is it just hocus pocus? Is it voodoo medicine? By allowing the actual patient to tell their story, I think it's very compelling, because here's real people telling real stories. There's no financial incentives. There's no conflict of interest. about what they're trying to say. They're just very, very, it's reality TV on the internet. You can have no doubt about what they're saying. So, I have quite a few of these stories, and I'm posting them one at a time so that hopefully by sharing it, we'll get the message out. So it's really a consciousness-raising effort.
That's really great you're doing that. I took a quick peek at it, and I really like it because it's really showing that people are feeling a satisfaction with it. With the traditional, when I talk to patients that are on the synthetic hormones, they keep telling me that their doctor keeps measuring their TSH and moving their medication up and down. And I'm like, well, has he looked at your free T3? And so to have the satisfied customers that you have on your thyroid project, I think that's really great to get the word out for people that are a little curious about it, a little thyroid curious. They can learn a little bit more.
Well, because, thyroid disease is so common, even if, a person who visits the site themselves doesn't have thyroid disease, I can almost guarantee they have a relative or a friend who could use the information.
Absolutely. So we should share that. Mm-hmm.
Right.
Yeah. And we had talked yesterday about Hashimoto's thyroiditis, and we're certainly seeing a lot of that. And that's one of the tests that's on our general test when we do our initial testing for hormone therapy. We're checking, the CBC, the chemistry, as well as the thyroid, the T3, total T4, free T3, total T4, TSH, and TPO antibodies. And so we're able to identify those things. So I've had many patients, once I've identified it, say to me, why did my doctor test me for this? I've been having my thyroid treated for years, and I didn't know I had this. So it's important to find a provider that's actually going to test you for the things that, for the thyroid in the right way. So I think that's one of the most important messages to people who are not having their thyroid checked is to get it checked.
Right. Well, in this age of rationing of medical care, many times the doctor will only order one of the several different thyroid hormone tests that are useful. That's called the TSH, and if it's normal, they're pretty much done. And the reason that that's not good is because, a person could have a early stage of thyroid deficiency and yet be very symptomatic, and they could be missed.
Yeah. Well, Dr. Pepper, I'm sorry to cut you off. We're having such a good talk. We're going to have to do another show with you. We're going to have to wrap it up. We're kind of out of time. But I want to thank everybody for joining us this evening and learning a little bit more about thyroid. And if you have questions, you can always give us a call at my office, Low TE Florida, 954-791-4498. Or you can go on our website, Low TE Florida, LOWTE Florida.com. To learn more about our pellet therapy, how we tie the thyroid together, because we've learned if we optimize the thyroid at the same time as the hormones, we get a far better result. So I hope you can join us next week. We're going to have the fun topic of sex after 50. Dr. Pepper, I don't know if you want to join us for that one, but we'll hope to see you all next week. Many men and women are feeling tired, moody, having difficulty